Diving in the Red Sea means sharing the water with an incredible variety of marine life. Sometimes that life fights back. Knowing when to rinse a wound with salt water and when to use fresh water is key to safe first aid for divers. First things first, make the diver safe. End the dive. Get them out of the water. Monitor their breathing and consciousness. Be ready to call emergency medical help or DAN. Serious symptoms? Trouble breathing, chest pain, weakness, loss of consciousness, or rapidly spreading swelling? Treat it as an emergency every time. Next up, simple first aid. Control serious bleeding with direct pressure, then decide on the right water to rinse. Correct rinsing cuts, pain, reduces toxins, and lowers infection risk until you reach a doctor or recompression facility. Use fresh water for wounds without cnidarians. We rinse with fresh water for injuries, not from stinging cells. Cnidarians. Think punctures from sea urchins, stingrays, lionfish, other fish, or regular cuts from rocks, ladders, boat gear. Fresh water washes out sand, slime, spine fragments, bacteria. It makes later treatment easier and safer. After rinsing with clean fresh water, gently dry if you can. Cover with a sterile or at least clean dressing. Don't tightly close deep punctures. Protect them. Seek medical help. These carry higher infection risk, may need antibiotics, imaging, or surgery. Use salt water for cnidarian stings. If it's a cnidarian, jellyfish, sea anemones, corals, box jellyfish, Portuguese man-o'-war, skip fresh water at first, rinse with seawater. Intact stinging cells often linger on skin, ready to fire again. Cnidarians live in salt water. Hit them with fresh water. They sense threat, discharge, inject more toxin. That's why a quick freshwater rinse can worsen pain and swelling. Seawater matches their environment. It cuts the risk of more firing. How to use vinegar correctly. Vinegar, with acetic acid, deactivates cnidarians for some jellyfish and kin. Apply locally briefly. Soak for 30 seconds. Then stop. Longer? It irritates or burns skin, especially sensitive spots or kids. After vinegar, rinse with seawater. Carefully remove tentacles or bits. Never rub with bare hands or towel that triggers more stings. Use tweezers, gloves, or a plastic card edge to lift gently. Why freshwater worsens cnidarian stings? Too early freshwater? Remaining cnidarians burst from osmotic shock. More venom floods in. Pain, redness, swelling, even systemic issues spike. A mild local sting can turn serious. Safe rule: suspect cnidarian. Start with seawater and vinegar if advised. Switch to fresh water only once cells are deactivated and gone. When to always seek medical help. Some marine injuries need pros, no matter first aid. Breathing issues, chest tightness, weakness, confusion, collapse, consciousness changes. Widespread rash, face or tongue swelling, fast worsening pain, or redness. That's allergy or systemic, get help. Seek advice after big hits from stingrays, lionfish, cone snails, large jellyfish, or punctures to joints, tendons, face. Neurological signs post-dive, numbness, paralysis, vision changes, speech trouble. Could be decompression illness. Head to Dive Med experts fast. DAN Emergency Hotline for Red Sea divers. Call DAN anywhere. Their Dive Med doctors coordinate with local hospitals. They guide on evacuation or hyperbaric needs. 24/7 lines work via apps. In Egypt, Hurghada, Sharm el-Sheikh, Marsa Alam, Dahab, use DAN International, +1 919 684 91111, plus local ambulances. Know your nearest chamber or clinic ahead. Check with your dive center, DAN site, or app. Good preparation and clear rules make all the difference.